Hello everyone, I'm Dr. Salman. We regularly share success stories. Let's talk about a failed hair transplant story. It happens fairly frequently nowadays. Patients come up, unnatural looking hairline, and one common thing that I notice in these patients, they come up with the complaint that when I'm talking to someone, they look at my hairline. Why do we look at things? There is a lot of information that come in from all our senses. You have voices, you look at things, you smell things, you feel things, but your brain actually cuts off most of that information. It feeds you only the ones that you truly need. But if there is something very unusual, your eyes stop on that. That's what happens with a failed hair transplant and a poorly designed hairline. If the direction is bad, if the angle is bad, if there are doubles and triples, if it's a doll's appearance, all of this is unnatural to the observer. And that's why they are talking to you, but they're actually staring at your hairline. This is what. Now the patient came to our clinic, and the first thing that I noticed was the pluggy look. It was the very low set hairline. It was the doubles and triples in the front. Now that is something which is very, very difficult to live with. You have to get it fixed. There is no other way. If the doubles and triples are at the back, you love them. But if they're at the front, it's like a car that has had an accident from the front. You have to fix it. If it's a rear bumper, you can leave it alone. But if it's the front, you definitely want to fix it up. Now, repairing a hair transplant is much more difficult than doing a hair transplant. I insist on that over and over again. And that's because I want to do the hair transplant for the first time. I want to plan the hair transplant appropriately. Sometimes I will want to do the hairline only. Sometimes I would want to do front dense, back less dense. Sometimes I would want to do the crown. And all of this comes with consultation with the patient. What I want to do, what I can do, and what the patient demands. And then we try to come up to a conclusion. But whatever we decide, it is all about a natural look. If the look is not natural, it is the one that would need repair. So now, in this case, we would remove the excess grafts, we'll remove the doubles and triples, I'll draw my signature hairline according to the face of the patient, and then we would try to take it up to that particular location with the singles in the front and the doubles and triples set back. We'll remove the thick grafts, we'll place the thin ones, and we'll place them in the right angle and direction so that they can grow and they can give you a hairstyle. In a revision case, every graft counts. I go to the safe donor. Sometimes I even target the areas which are, according to the book, not safe, because it is an emergency situation. It is something that I have to fix, otherwise things are going to go wrong. So as a consultant, I'm allowed to go an extra mile. So every graft matters, every graft at the scalp. It is very, very precious. And then we have the donors, the beard, at the neck, sometimes even the face. With the microcephaly, we can take grafts even from the face. It heals very well without any scars. But let me insist, it's very difficult to repair a damaged hairline. Secondly, it costs more. It's going to cost more because it takes me more time. It takes me more effort. It takes me more planning. Sometimes there are multiple visits to remove the hair from the front with one session. Sometimes it is impossible to remove all of the grafts because they are so closely spaced with each other. So always try to get to the right surgeon in the first place. Always try to pick a plastic surgeon for your hair transplant who has good experience with managing the hair transplant complications. It's not about the very good results, the very extraordinary result. Anyone can produce an extraordinary result in an excellent donor. But if you give a repair case to that same person, he would not be able to fix it. I've seen a lot of cases done in Turkey, and the same clinic actually refused to do the second transplant. But if you're in Pakistan, if you're in Islamabad and Peshawar, I'm there to help you out. So book your consultations with my managers. Don't worry, we can fix your hairline. And subscribe to our channel for more informative videos. Thank you.